Dear all, Namaste. In this video, I shall be discussing about vocal nodules. They are non-neoplastic lesions of the vocal cords. They are also named after singer's nodules, teacher's nodules, or screamer's nodule because they are usually formed due to vocal abuse or vocal misuse or prolonged use of the voice. They are bilaterally symmetrical, localized, benign and superficial growths on the medial surface of true vocal cords. The medial surface is the mobile surface of the vocal folds. They appear at junction of the anterior and middle one-third of the vocal cords because that is the area of most vibration of the vocal cords. Therefore, when there is maximum vibration, there will be trauma to the vocal folds and vocal nodules appear. The etiology is overtaxing and incorrect use of voice over long period in teachers, telephone operators, singers, screamers, which has already been discussed. Let's come to pathogenesis of vocal nodules. First of all, when there is misuse of voice or vocal abuse, there will be stage of transudation. The maximum vibrating area of the vocal folds will have transudate in the submucosal plane, which is reversible condition if the patient does not speak for at least 7 to 10 days. The second stage is stage of vascular ingrowth. In the area of maximum vibration, when there is edema, then there will be submucosal neovascularization. This condition is also reversible condition. The patient has to strictly follow vocal hygiene and shouldn't speak for 1 week. This is also reversible condition. The third stage is stage of fibrous organization. In this stage, the submucosal transudate is replaced by fibrous or hyaline material, which is resistant to conservative treatment. Therefore, voice therapy only is not enough in this condition. Patient requires surgical resection of the vocal nodule. Let's come to the clinical features of vocal nodules. When the nodule is small, the patient will be unable to sing high-pitched notes. There will be increased effort required for singing and the speaking voice will be almost normal. When the nodule is small, then there will be obvious phonatory gap that leads to unable to sing in high pitch. When the nodule is large, then there will be obvious air escape from the phonatory gap. There will be low pitch, harsh, breathy speaking. The patient will have fatigue voice and a decreased pitch range. That is due to increased phonatory gap between the vocal folds due to vocal nodule. The early nodules will be seen as soft, reddish and edematous during indirect laryngoscopy or flexible laryngoscopy, and the large nodules or late nodules will be seen as hard, grayish or white because they are fibrosed, and that is replaced by hyaline material which becomes whitish in nature. In this slide, you can see the vocal nodules. These are the early nodules, early vocal nodules, and these are the late vocal nodules which are fibrosed and which are thick. What is the treatment? Non-surgical treatment is absolute voice rest for 2 weeks. When the patient does not speak for 1 to 2 weeks, then early nodules will disappear. Patient has to maintain vocal hygiene. Patient has to avoid mouth breathing, smoke and other allergies. That also leads to dryness and repeated throat clearing, which leads to more pressure on the vocal folds and straining of voice. The patient has to maintain adequate hydration and patient needs to take steam inhalation from the nose. That also helps in decreasing size of the vocal nodule. Steam inhalation can be taken twice a day, 5 minutes in the morning time and 5 minutes in the evening time. Patient has to undergo voice therapy for 3 to 6 months. And the speech therapist or voice therapist helps an emphasis on use of optimum pitch, that is effortless voice. Don't speak too hard or don't speak too soft. Surgical treatment is indicated if adequate voice therapy shows no improvement in 3 to 6 months. Minimum of 2 months therapy is required. The surgery is microlaryngeal surgery or laser-assisted surgery on the vocal nodule. After surgery, post-op voice therapy is continued for 3 to 4 weeks for residual hoarseness. Sometimes patient may have some form of hoarseness for 3 to 4 weeks. This video shows microlaryngoscopy and excision of vocal nodule. You can see the vocal nodule here. This is the vocal nodule being excised or cut. So after surgery, how to use voice? The patient has to take absolute voice rest. So absolute rest from talking, humming or whispering, throat clearing and forceful coughing for at least 1 week because the wound should heal. The wound healing takes around 1 week to 10 days. From the second week, the patient can have limited talking. For singing purpose, patient should not sing for 1 week. The wound has to be healed. For the second week, patient can sing for 5 to 10 minutes twice a day. And for 3 to 4 weeks, patient can sing 15 to 20 minutes twice a day. If the patient follows the doctor's orders or voice therapist orders, patient should be alright. Therefore, if you have vocal nodule or if you have hoarseness, please don't speak for some time. Don't cry, don't whisper also. If you like this video, please subscribe my channel Dr. Krishna Koirala for more videos like this. Thank you so much.